I want you to think back to a year ago this week. In an iconic image, Rosalinda Lopez, a registered nurse at Genesis, flexed her arm as this generation's Rosie the Riveter after proudly taking the life-saving COVID-19 vaccine. This one image conveyed hope after a long period of darkness, suffering, and death. A year later, we're still living in that shadowy time before the sun fully rises. In the Quad Cities, we sit at a 60% vaccination rate for those 5 and older. This means that 40% of those eligible to be vaccinated have not stepped into the light to end the pandemic. We're back to overflowing hospitals, exhausted healthcare and public health workers, grieving families. Except this time, it's all preventable. Today, we're joined by Dr. Kurt Andersen of Genesis Health System, Dr. Olutade of UnityPoing Health Trinity, Amy Thoreson, the director of the Scott County Health Department, Nita Ludwig, the administrator of the Rock Island County Health Department, to talk about the dire situation in our hospital systems and quickly rising cases. First, let's start with Dr. Andersen. Thank you.
Thank you, Janet. I agree with your opening comments. We are facing in the hospitals, in some areas, a situation that's worse than it was a year ago. Although our total number of cases have not reached the peak that we had last winter, we've been averaging over the past week 70 patients in our hospital with COVID. The biggest challenge is in our critical care areas. This morning, of all of our critical care beds available within Genesis Health System, 80% of those beds are occupied by patients who have COVID-19. Of those patients, consistently throughout the pandemic, 90% of those have been patients who have not been vaccinated. So very sick, unvaccinated patients in our intensive care unit. We do everything we can to take care of those patients and to get them better and get them back to their lives. And some of them we do, and some of them don't recover. The other reality that you have to face is when we have complete saturation of our intensive care unit, that means we have 20%, remember, 80% COVID, 20% of our ICU beds for all the other care that we need to provide to our community. Patients who have acute stroke, patients who have a heart attack, patients who have a emergent surgery that requires intensive care after the surgery. We're reduced to 20% of our capacity to be able to manage those cases. So that means if you or your loved one is in has a traumatic accident, has an unexpected medical catastrophe, we have not near the level of care that we would normally have to take care of any problem, let alone COVID. So this is a severe situation. It's worse than it's ever been. It's worse than it was a year ago. We have patients who are waiting for intensive care units for days in our emergency room. We don't have any room. We have no bed available. There's no bed available in the region. So I think everybody wants this to be over. Certainly I do. I know our care teams do. They're exhausted. But we still need to manage the pandemic the best that we can, and we need the community's help to do that. We simply can't provide the highest level of care to our community when our emergency rooms and our critical care units, the place where our sickest patients need to be cared for, are completely overrun with patients with COVID. And again, 90% of them unvaccinated. So there's no mystery here. We know what works. There's no debate anymore. Vaccines are safe. Vaccines are effective. If you haven't received a COVID vaccine, we would ask that you get your vaccine now. If you've received your COVID vaccine series and you have not had a booster, we ask that you get your booster vaccine now. If you haven't had a flu shot, get your flu shot. We have not yet seen our flu season really in any meaningful way. Last year, we really didn't have a flu season because people wore masks, because people maintained social distancing. Those things also still work. When you're indoors, you should be wearing masks to prevent the spread of respiratory infections. You should be practicing social distancing. We know what works, and we need your help. We need the community's help. We have tired care teams. They are doing everything they can to take care of our community, but we are at the complete saturation of our system for critical care beds. And, we're continuing to work on contingency plans. We continue to do everything we can to help meet the needs of the community, just like Dr. Olutade's team at UnityPoing. But there's a finite end to the resources that we have available to take care of our community, and we absolutely need help in getting the pandemic under better control. I cannot be stronger in those comments.
Thank you so much, Dr. Andersen. Next, we'll hear from Dr. Olutade with UnityPoing.
Hey, thank you, Brooke. And I would say that it's just as if Dr. Andersen and I shared notes. What he's describing at Genesis Health System is what we're experiencing here. And if you want to add more detail, it's really, I'll say this morning we had the percentage occupancy of our ICU beds. In the Quad Cities here, it's 120%. That means we've gone over what the beds that we actually have. And again, 80% of these patients are COVID-19 patients, and these are patients that spend weeks in the intensive care unit. Look at our beds on the regular floors, percent of the occupancy level, it's more than 100%. So there are actually no physical beds available there. Patients are filling our facilities, and these are not only COVID-19 patients, but also non-COVID patients. We have a lot of sick patients in the hospital. And I will add that, you do not plan to have a heart attack. You do not plan to have a stroke. You do not plan to require emergent surgeries. These things happen because life happens. And that's why we're here, to be able to care for the community. However, we have to say that the staff is tired, is exhausted. They're working long hours. I mean, the people that work usually 12-hour shifts, they have to work 14-hour shifts because work is so much, and they have to come back the following day to continue to care for the patients. Many of them have had the opportunity to travel out, to go to be a traveler somewhere else, but they've chosen to remain in the community to serve the community. So they're not doing this work for a paycheck or for the hospital. They all talk about the patients that they're seeing. They feel indebted. They feel it's their duty to take care of the patients, and that's what we're here for. But our resources they're not unlimited. They are finite there, and we're beginning to see the cracks because it's not easy to keep on going this long for 20 months plus in this nonstop pandemic and with the high levels that we're having. I know that many of us hope and are hopeful that this will stop. And yes, we're in the same boat. We do want this to stop. However, our actions will determine whether this really we're able to slow the rise of infections. We cannot just sit and hope and then not take necessary actions. We all want to gather for Christmas and meet with families. That is awesome. But we want to go for Christmas services at churches, and that is great. We have to take precautions that are necessary in those situations. If we have to mask in those situations. We know masks help, and we know what also helps. Vaccines help. We have millions of people who are vaccinated in the United States. They're still walking on their 2 feet, and they're still doing fine. And they are the ones that are they're helping to demonstrate that vaccines work. In the healthcare systems, we have overwhelming majority are vaccinated because that's how we maintain a healthy workforce to care for our patients. But our patients and the community right now need to help us. It's not just about the health systems. This is all hands on deck. There's a lot we can do to help our community and our health systems. I know many of us have shared their note of thanks. They've called healthcare heroes, and that is appreciated. But I would say right now, the season of giving, the best gift you can give right now is to take the necessary precautions, including vaccination, getting boosted, and masking in indoor spaces. I mean, those gifts will be, they are priceless for the healthcare teams right now because we're busting at the seams. We've gone over what we usually do, and we keep on keeping on, but we know that our resources and our strength is not unlimited.
Thank you, Dr. Olutade. Next, we will hear briefly from our public health partners. So first, we'll hear from Amy Thoreson with Scott County Health Department.
Good morning. As a member of this community who lives here, works here, and is raising a family here, I'm scared that both of our hospital systems that my family and I depend on for care when we need it may not be available for us. I'm also really frustrated. Public health has no other tools at its disposal to change the current COVID-19 situation around. We can only offer vaccine, offer test kits, and promote masking, all as widely and loudly as possible. But it is now up to our community. It is up to each resident to make a choice to be part of the solution or, unfortunately, be part of the problem. You may not like the options in front of you, vaccines and masks, but you can't like the situation in front of you either if you need medical care for you or your family. Choices are hard, and now is the time to act.
Thank you, Amy. Lastly, we will hear some updates from Rock Island County Health Department with Nita Ludwig.
Good morning. We don't quite yet have the numbers of new cases for today, but I will relay that as of Monday, we had 226 new infections of COVID-19 from the weekend. And our total number to date is now 21,653 for this pandemic. I can tell you that today in our press release, we will be reporting 5 total deaths in our county, and that brings our total deaths in Rock Island County to 399. The primary mission of the health department is to prevent illness and the spread of disease within the community. We do this through vaccination. Vaccines have been thoroughly tested and are safe. Vaccines work. COVID-19 vaccine will protect people from serious illness and death. Vaccines protect others. Everyone 5 and older has plenty of opportunities to get vaccinated against COVID-19. Rock Island County Health Department holds walk-in clinics for those over 12 on Tuesdays and Fridays every week in our building here, 9 to noon and 1 to 4 p.m. Moderna and Johnson & Johnson are offered on Tuesdays, and Pfizer is offered on Fridays. We have been averaging 150 shots per clinic day here at the building, but we can do more. We can do more shots on those days. Please stop in and get vaccinated. There are also many pharmacies, community health care, and other healthcare providers in the county to obtain a vaccination. You can also find a shot at vaccines.gov. The time to act is now. The sooner we get the community vaccinated, the sooner we can end this pandemic. These small steps will help us all get back to the things we love and the people we love, which includes get vaccinated and get your booster, wear a mask when you're indoors, social distance, wash your hands often, and please stay home if you're sick. Thank you.
Thank you very much, Nita. We do have a couple of questions we'll try to get to in the time that we have allotted. We have about 10 minutes left. The first question, and maybe I'll have Amy and Nita speak to this one because we were just on the QC COVID-19 coalition call earlier today. What are the hospitals and public health departments doing to reach people who have not been vaccinated? Are you trying to identify who the vaccinated are and exploring how to reach them and influence them to get vaccinated? Do you want to start with that one, Amy?
Sure. We're continuing to do a variety of messaging through social media, traditional media, through these briefings. And then we're also working with partners throughout the community to identify populations and groups that may have been missed. Now, we've been talking about COVID vaccine for a year now, and you can't drive by or walk by some of our local pharmacies without seeing a sign for it. But we're continuing to look for ways to message and provide special opportunities for groups like the homeless at a variety of different shelters. We also continue to offer the Johnson & Johnson vaccine locally here at the health department on a walk-in basis. And then we're also working with some partners, and hopefully we'll have some additional messaging coming soon. There's messaging from all levels of the federal partners, private entities. I think there's hard times to watch a television show without hearing something about getting a COVID vaccine.
Thank you. And I don't know if any of you can speak to the impact of Omicron locally. I know our state hygienic laboratories are testing for that. Looks like Dr. Katz is on with us and might be able to speak to that for us.
Yeah, the impact in Iowa and Illinois is minimal. still. A couple of percent of sequences in Illinois, and less than 1% of the sequences in Iowa are Omicron. The surge that we're dealing with now is all Delta. So I don't have a crystal ball. I fully expect Omicron to become more common, but it's not what we're dealing with now.
Thank you. Dr. Andersen and Dr. Olutade, at what point will elective procedures or surgeries be paused to manage the high number of COVID patients? I know our situation last year was quite different with some of the requirements that the state had put in for mitigation, but if you could speak to that and give the community an understanding.
Yeah, I can start with that, Brooke. We've already began pausing elective surgeries, surgeries that might require a hospital bed. We're capping those because we simply don't have beds available to meet the needs of the community. So we're already capping elective surgeries requiring a bed. That includes things, and we certainly have a difficult time proceeding with any kind of surgery that is pre-planned that requires ICU bed. We simply don't have the bed. And, you know, if you need a cardiac bypass surgery, yes, I guess that's elective, but it's a severe condition that needs surgical intervention, and you're waiting until we can find an ICU bed. And there's a potential that bad things can happen while you're waiting. So we're already capping and reducing elective cases, and we will have to continue to do that and maybe continue to increase that if our numbers continue increasing. So we'll have less and less capacity to do elective care. We simply don't have the beds and staff to do that while we're treating all the other patients who are sick. And we're busy, you know, and so is UnityPoing. We're not just busy with COVID patients. I mean, that is the problem that's pushing us over the edge, but we're just busy with all the other things that we have to take care of.
Dr. Olutade, is the same situation taking place at UnityPoing?
Yes, it's the same thing. We've limited the number of elective cases that we're doing. We work with our surgeons to identify patients that we can delay and hopefully also minimize the potential risk. But I'll be honest that we've had an open heart surgery postponed recently because of the bed situation. And so these are the major surgeries. We have lung cancer patients that need surgery that we have to sometimes delay. And we're trying to accommodate all this necessary procedures. So every day we look through what surgeries are scheduled, and we'll look at those that can be delayed a little bit. And there's some that have to keep on going because the delay will cause more harm to the patients. But overall, it's we've capped and limited how many elective surgeries we're doing at this time.
Thank you. I'm going to skip down to the next question for the two of you, and we will get back to you on the public health in terms of seniors getting their boosters. Can you speak to the definition that's being used for unvaccinated in the hospital? Brief is fine. Is it someone who's not received any vaccine, those that you're counting as unvaccinated in the beds?
Yeah, we track both. You know, have you received a full series? We haven't considered a booster as being a full series yet, but we will move to that. So if you had a Johnson & Johnson vaccine or 2 of the mRNA vaccines, you're fully vaccinated. We also track partially vaccinated. So those would be the patients who received a single dose of the mRNA vaccine. And so when we look at when I say unvaccinated, we consider the partial vaccinated as well.
Thank you. Okay, I'm sorry, just going through these questions here. Dr. Andersen, today marks the 1-year anniversary of Genesis giving its first round of vaccinations to its healthcare workers. If you have a moment to give a brief reflection on the past year, what would you say about that? And are you happy with compliance that you've had so far with those getting vaccinated on your staff?
Yeah, we're very happy with where we ended up on vaccination. We're, you know, at about a 90% rate, higher in some of our pockets, including our physicians that are virtually fully vaccinated. I think we're at 98% or more. So we've had very good response to our staff to vaccination. It's been, you know, we have seen significant improvement in the number of staff who have had ill calls because of COVID. So the vaccine has worked in protecting our workforce. Also, you know, we're now moving into the phase of getting all of them their booster doses as well. So we're in that process. We began that a month or 2 ago. and we've had good response there as well. So our goal is to keep our staff as safe as possible because we need them to help take care of the community.
Thank you. Dr. Olutade, we have just 2 questions. I'll get to you really quickly. I know you both have to get to another commitment. How much of a game changer would Pfizer's pill be if it were officially approved and brought to the hospitals in the QC?
Yeah, that would be awesome to have that another tool in a toolkit to care for patients. I would say it's easier to take because the pill and not you won't have to go to an infusion center to get that. However, it also hinges on early diagnosis. So if you have symptoms, you need to get tested early enough for that pill to be effective. So, but it's a game changer. The Pfizer pill in particular, very encouraging information on that, and looking forward. I can't wait to have one more thing to help fight off this COVID-19 pandemic.
Then we will end our question, and perhaps Dr. Katz can answer this one. Obviously, breakthrough cases are continuing to happen. Can you say why people should still get vaccinated and boosted even if they still get COVID?
Yeah, I put an answer in the chat, but breakthrough infection in the vaccinated is absolutely expected. These vaccines were authorized based on their impact on illness, not infection. The point is the vaccination greatly reduces the risk of severe illness, hospitalization, ICU care, mechanical ventilation, extracorporeal membrane oxygenation, and death when breakthrough occurs. You get less sick if you're vaccinated. And looking at who's in the ICUs is the best evidence we have of that. As Kurt told you, 90% of the ICU COVID admissions are unvaccinated.
Well, thank you to both of the providers on here with us today. Your leadership in this continues to be a great benefit to our community. Thank you to our media partners. We hope you will assist us in sharing, again, this information as broadly as you can. The recording will be available shortly on both our YouTube, our Facebook page, and our website, and so we will share that broadly. If you have any additional questions, please don't hesitate to reach out. Thank you all for your time. Have a good rest of your day.